Hey everyone, welcome back. We're diving into a topic today that's, well, let's just say it's not exactly light dinner conversation,
Right, not exactly.
but it's something that's surprisingly common and really important to understand.
Absolutely. Affects a lot more people than you might think.
We're talking about deep vein thrombosis, or DVT for short. And to guide us through this deep dive, we're tapping into the latest recommendations from Spanish medical experts. So, to kick things off, when I first heard DVT, I'll be honest, I pictured, something that only affected grandparents. But as it turns out,
It can happen to anyone, really.
yeah, exactly. And that's one of the things that makes it so crucial to talk about. But before we get into the nitty-gritty of who's at risk and all that, let's start with the basics. What exactly is DVT?
So in the simplest terms, DDT is when a blood clot forms in one of the deep veins, most commonly in the legs.
Okay, so we're not talking about, like, a little scratch on your knee here.
No, not at all. These are veins that are deeper down, running through the muscles.
And the Spanish experts specifically called out certain veins, right? Like, not just any deep vein is equally likely to be a problem.
Right. The paper mentioned the tibioperoneal trunk, soleus gastrocnemius veins. Those are in the calf area mostly. And then in the pelvis, you've got the iliofemoral and popliteal veins.
Okay, so those are some serious tongue twisters. But knowing the names isn't really the point, is it? It's more about understanding why those specific veins matter.
Exactly.
And this is what really gets me about DVT. It's like, it can sneak up on you.
Yeah, it's not always obvious, that's for sure.
Right, like, how is anyone supposed to know if they should be worried about a blood clot forming in their leg?
Well, that's the tricky part. The symptoms can be pretty easy to miss or to mistake for something else.
Exactly. I mean, if my leg hurt, I'd probably think, oh, I pulled a muscle or something like that.
And you're not alone. Most people don't immediately jump to DVT.
So then what are we supposed to look out for? How do you even begin to figure out if it's something more serious?
So some of the common signs are swelling in the leg, pain, tenderness. It might even feel warm to the touch.
Okay, those are all things I could see myself ignoring for a while.
And that's why it's so important to know your own body. And if something feels off, especially if you know you have some of the risk factors, it's always best to err on the side of caution and get it checked out.
Okay, so let's say you do go to the doctor. How do they actually diagnose DVT?
So it's not like there's one simple test that gives you a definitive answer, unfortunately. Doctors use a combination of things, like asking about your medical history. Of course, they'll examine you physically, and then they'll probably run some tests.
I've heard the D-dimer test, that's for blood clots, right?
Exactly, yeah. The D-dimer test, it basically detects a substance in your blood that's released when a clot breaks down.
Okay, so if the D-dimer is high, that's it, you got DVT.
Wish it were that simple. The thing is, D-dimer can be elevated for all sorts of reasons, not just DVT. So infection, inflammation, even pregnancy can throw it off.
So it's kind of like a blaring alarm means something is wrong, but you don't know what's causing it.
Perfect analogy. It's a clue, not a diagnosis on its own, right?
Got it, so it helps rule things out, but it's not the final word. What about imaging? Isn't there a way to actually see these clots?
You're thinking of ultrasound, and you're right, that's the gold standard, especially compression ultrasound with color Doppler.
Color Doppler, what's that all about?
So it's a specific kind of ultrasound that allows doctors to visualize blood flow, see if there's any blockage, because of a clot. Really gives them a clear picture.
Wow, that's amazing. So if the ultrasound comes back clean, you're in the clear.
Most likely, yeah. If they don't see a clot, it's very reassuring. Usually no needs for further testing.
That's good to know. But let's say they do find a DVT. What happens then?
Well, the next thing is to figure out if that clot has caused any other problems, specifically if it's traveled to the lungs. That's called a pulmonary embolism, or PE for short, and it's a serious complication.
So even if they found the clot, the investigation isn't over yet.
Exactly. You got to get the full picture to know how to treat it best.
Okay, so let's say after all that detective work, a doctor says, yep, you've got DVT. What happens next?
Well, the first priority is to keep that clot from getting any bigger, and even more importantly, to prevent it from breaking off and causing trouble elsewhere.
And that's where the whole blood thinner thing comes in, right?
Right, although, it's a bit of a misleading term.
How so?
Blood thinners, or anticoagulants as they're properly called, they don't actually change the thickness of your blood. What they do is interfere with the clotting process itself, so it's harder for those clots to form in the first place.
Oh, I see. So it's not about thinning the blood. It's more like putting the brakes on clot formation.
Exactly. And there are different types of anticoagulants, each with their own way of doing that.
Right, we touched on warfarin before. That's one of the older ones, right?
Yeah, warfarin's been around for a while. It works well, but it does require those regular blood tests to make sure the dose is right.
And I'm guessing that's where the DOACs come in, the newer kids on the block?
You got it. DOAC stands for direct oral anticoagulant, and they've become pretty popular. The big advantage is they don't need that constant monitoring that warfarin does.
That's got to be a relief for people, not having to be at the doctor's office all the time.
Absolutely. Makes it a lot easier to manage. But it's not a one-size-fits-all situation. Some people might not be good candidates for DOACs, depends on their overall health and other medications they might be on.
Speaking of which, are there any other situations where DVT treatment gets tricky? Let's think about, like, what if someone's pregnant?
Really good point. Pregnancy definitely throws a wrench in things. You have to be careful about what medications you use because some can affect the baby. So in those cases, LMWH is often the go-to choice.
LMWH, remind me what that stands for again.
Low molecular weight heparin, it's another type of anticoagulant, and it's considered safe to use during pregnancy.
Okay, good to know. So basically, if you've got DVT, staying in close contact with your doctor is key.
Absolutely. Regular checkups are super important to keep an eye on things, adjust medications if needed, make sure everything's going smoothly.
Makes sense. Now, beyond medication, is there anything people can do on their own to manage DVT? Like other lifestyle changes that help?
Definitely, yeah. Compression stockings, for one, those can make a big difference.
Oh, right. Those, I always thought those were just for, like, people on long flights.
They can be helpful for travelers too, for sure. But for someone with DVT, wearing compression stockings regularly can help reduce the swelling and pain in their legs, make things a little more comfortable.
Okay, so it's not just about preventing clots. It's about managing the symptoms, too.
Exactly. And then, of course, there's the usual suspects: healthy weight, staying active, staying hydrated, all that good stuff.
So really, a lot of the same things that are good for your overall health are good for DVT, too.
Exactly. And the more you understand about DVT, the better you can advocate for yourself, ask the right questions, make informed decisions.
This whole deep dive has been a real eye-opener, I gotta say. It's one of those things you don't hear about every day, but it's so important to be aware of.
I agree. And hopefully our listeners feel more empowered now, knowing the signs, the risks, and what to do.
Absolutely. And if anyone out there is worried about DVT, especially if you've got a family history of blood clots or you're having surgery soon, or, hey, even if you just have that nagging feeling that something's not right, don't wait. Talk to your doctor.
Couldn't agree more. Early detection is key.
Big thanks to everyone for joining us on this deep dive into DVT. It's been a pleasure, and we'll see you next time for another fascinating deep dive.